Good afternoon, ladies and gentlemen. I am Dr. Doaa AbdelAziz, lecturer of Pediatrics, Pediatric Cardiology, and Quality Coordinator in Cairo University Specialized Pediatric Hospital, in charge with the Project 5S Kaizen. At first, I will give a short introduction about quality. The question is, aren't you frustrated in your workplace? Because, you know, as university hospitals, we receive too many patients in one day. There is a lot of work, too many things to be done at the same time. Nurses as well have too many complaints from the workload. We also have problems in the budget, the cost of the health service. So what is quality? Quality in healthcare means the degree to which health services for individuals and populations increase the likelihood of desired health outcome and are consistent with current professional knowledge. I always say to myself, quality means when I go to my work and I am satisfied in my work as a doctor, and the patient as well is satisfied of the service I offered to him. Of course, there are too many quality programs in the world. In Cairo University Specialized Pediatric Hospital, we adopted the ISO 9001 in the post-surgical ICU. We chose this project because it was more convenient for us. As you will see in the next few minutes, how nurses shared in it, how they were pleased that they joined this project. Actually, every healthcare service facility can choose the suitable quality project that suits their resources and the nature of the services they offer to patients. This 5S Kaizen is the first step of a total quality management. The base is the 5S, then Kaizen, then total quality management. How can we work together with positive attitude? Even if you have positive attitude, you need tools. How to make this positive attitude makes your work more professional. What is 5S? 5S is a philosophy and a way of organizing and managing the workplace and the workflow. As you can see in this photo, two shops, one with too many things in one place, unsorted material. Which shop you prefer to buy from? So 5S is like this. It's a philosophy of organizing the workplace. We have 5 S's. They originated from the Japanese language, Siri, Saitun, Saisu, Sikitsu, and Sitsuki. Siri means sort, Saitun is set, Saizu is shine, Sikitsu is standardize, then sustain. Actually, we made an Arabic translation of this 5 S's to be easy for the nurses, as you know, because they only understand Arabic language. We joined the 5S project since April 2016, as 4 key persons were selected by the director of the hospital, and they started to attend the workshops offered by the Japanese International Cooperation Agency, and we started to make like a work team in every place in the hospital. But we selected 3 pilot areas to implement the full Kaizen activity. Started orientation sessions and hang posters on 5S corners. Sorting. As you can see in the drawer, too many things. Unknown material, papers, syringes, needles, too many things. The nurses, after learning this 5S, they started to use the material available in the workplace, and they just wrote like a label and sort things and use labeling. They also used too many ideas and novel ideas, we give them a free hand to express how would they make sorting. They used these containers to separate the oral drugs, antibiotics. They used also the labeling. They wrote in the outside of the container. They used the plastic containers or writing in Arabic. They used the color code with the working machines are not working. They use the green one for the working ones and the pink one for not working one. After you sort everything in your workplace, you have to set this thing in the suitable place. The suitable place is the place where I can find this thing easily when I am on job. For example, a patient on the operation room, and I'm working in a cath lab, for example, and I'm asking for something. So everybody has to know where is this thing, and it should be close to the operator by the importance of this and how frequently I use this thing daily, weekly, or something. They used also what they call in 5S zoning to fix the places of machines in the workplace. This is how they get rid of any extra machine. Shine means the making everything clean. Standardize is to use a common language. As you know, too many hospitals adopted this system of coding of drugs. Red drugs is the drugs of high-risk drugs, inotropes. The yellow ones are the sedatives. Green ones are for the anticoagulant. White is for fluids, plasma, blood. They wrote these things, the nurses themselves, and they put it in a file and hang it on the 5S corner everywhere in the hospital. Sustain means using like a checklist, sort, set, shine, how many marks the head nurse give her work improvement team evaluation. This evaluation, we told them to make it minimally 2 times per week, and it should be actually done daily. We started, this is a refrigerator with too many drugs. Now they sorted it with colors. This is how can we make filing with numbers or alphabetical. How symbols can help the patients to know the direction of emergency exit. This is the operation room and the safety signs. As you know, one of the most important issues in quality is the safety of the doctors and whoever healthcare worker and the patient as well. We describe to them the rules and responsibilities. We make like a competition between the different departments of the hospital, and we made 2 evaluation visits using the scoring system offered to us by the JICA themselves in an Excel sheet. Then at the end, we calculated the average for each place. As you can see in the photos, how the condition before and after. This is the celebration of the best scores of the 5S. How can you make the nurses indulge in quality if they feel it like it will improve their work and decrease their workload? They will be motivated to join this project. What kind of benefit is making the work environment convenient? You can bring any item on your workplace in a very short time. You can make the hospital environment healthy, and you will be satisfied at the end of the day. Now to Kaizen. What is Kaizen? As Professor Dr. Magid said, this is Kai and Zen. Kai means change and Zen means improvement. It is a method of problem solving. So, I have to make something called gap analysis. What is the ideal situation? And what is the current situation? The gap between them. If I could fill the gap, this is the Kaizen. So it is filling the gap between the actual situation and the desired, the ideal situation. It depends mainly on very easy way of calculations. We have two types of Kaizen. One they call the small Kaizen for small problems. For example, in the ICU, we had a door which opens in two directions. So somebody stuck in the door and he had an injury in his hand. What is the small Kaizen? Just write an instruction of the direction of the door opening outside. This is one of the small Kaizen. They show here example for somebody in a hospital where he used the IV fluid sets to give water to the plants. How can he use the available resources in any other thing? But you have to know that Kaizen is your work, not others. And it depends on your positive wishes. I will give you the example of Kaizen that we worked on in Cairo University Specialized Pediatric Hospital. Actually, we chose the cath lab as the pilot area. Actually, Kaizen depends on 7 steps. Selection of Kaizen theme. What is theme? This is your wish, what you wish. Then you make a situation analysis. As we said, we want to fill the gap between the ideal situation and the actual situation. Then you take the root cause, identify the countermeasures, put an action plan, then see what is the effect. Here we chose 5 wishes. Because we work in cath lab, we have a long list of patients, scheduled patients, emergency patients. So we used waiting time for patient to receive the service is reduced. We have patients who come at 8 a.m., for example, in the secretary room, and they didn't get the service except after 12 p.m. I will show you the actual situation. So we wish to reduce the time of the patient to receive the service. Schedule patients admitted prior to cath, have proper preoperative preparation, the waiting area will be good, and too many wishes. And you make what is called feasibility. You want to know what is the most important and what is the most feasible for you to start with. We can start with other things, but we make priority for this one. So we choose this theme. Waiting time for patient to receive the service is reduced. After that, you have to analyze the actual situation. When we make like a statistical analysis for our patients, we found that we have only 27% of patients wait only 60 minutes. So he comes, for example, 8 a.m., he is on the table at 9 a.m. It is okay. But we have another 32% from 1 hour to 1.5 hours. And we have 41 patients who wait more than 2 hours to receive the service. So what is the composing factors of this problem? To make something like composing factor, you have to take the process as a whole and make analysis of every step of the process. So I want to explain to you what patient do at the day of the cath. He comes, give the papers to the secretary, then the anesthesia see the patient and say he is fit for cath. Then the most junior staff see the patient, then he waits for the mid-senior, then the head of cath lab or the most senior professor, he is the one who decides what is the type of cath to be done at that time. So this step we found by what they call the cumulative frequency. To set in order the most important composing factor, it was the confirmation of diagnosis. Because you know we are a university hospital, we receive too many patients from all over the country with echoes done outside. Sometimes we need to repeat echo. Some patients came to refer to us, this patient is indicated for cath, and when we check the echo, he is not indicated. Or they say, close the PDA for this patient, and we see, no, he doesn't need. So this debate in the opinions takes time from the patient, and sometimes he will wait until the senior professor come, and maybe at the end he says, while the patient is fasting, the patient doesn't need cath today, postpone. The second problem is late attendance. The third problem was the time taken to make admission papers. And we have too many, but what they call in Kaizen the vital few. So you choose the 20% which when you solve, you will solve the 80% of the problem. So this is what they call the calculation, situation analysis, calculation table, and accumulation ratio. Those were the vital few: confirmation of diagnosis and late attendance of consultants. How can we work on this? This is what they call the root cause analysis. Root cause is you make something like methods, materials, man, and machine. For example, for man, there is a high workload on nurses. For example, in material, there is no standardized checklist for reviewing and verifying the patient data. I will show you in the action plan. This is the identification of countermeasures. You take every problem and try to overcome this problem. This is your action plan. For example, patients come to the outpatient clinic, as I will show you in the photo here, and take a date for cath. So why not to make like an IT link between the outpatient clinic and cath lab, so the junior staff or the assistant can check the diagnosis the day before the day of doing cath, and he can inform the senior staff. Using the IT system, we can make like a scan and put all the patient data on this IT. Deficiency of updated guidelines. If everyone has his own personal opinion. So what is the solution of this? Develop a guideline, conduct a meeting with all professors, and make like a brainstorming meeting. Unclear patient pathway on cath day, conduct a meeting, then settle a clear pathway on the cath day. Individualized system, as I told you. Absence of standardized checklist, absence of verbal instructions to the patients. Sometimes we schedule patients and they come at the day of the cath with fever, or sometimes the mother is not taking care of the hygiene of her child, so the cath will be cancelled, but on the day of the cath, unfortunately. So why not to develop a verbal instructions for the illiterate patients? After you identify the countermeasures, again you make a feasibility. What is the easiest and what is the most urgent? And at the end, we did this. We did brainstorming meeting with the head of the cath lab and the senior staff there. What do you think if the junior or the one who's assisting you come a day before the cath or at the day of the scheduling and check everything of the patient? We conducted training to secretary to revise all the patient data, implement a schedule for workers, because you know the patient comes and somebody takes him to a waiting area and come back again. A patient educational video, we developed like a video on YouTube, how to prepare your child for cath. We conducted like an IT link between the cath lab and the outpatient clinic, so everything, as I told you, can be put on this IT, and we can check it from the cath lab the day before, the 1 week before, the day where when the patient was scheduled, and we conducted like a training for nurses for proper preparation of cath. This is the IT link, this is the outpatient clinic, and these are the lists. This is orientation of nurses of the preparation. Also, we assumed this cycle as to make the day arranged. Why the patient waits for the anesthesia to come or the junior to come? We specified the first half an hour in the early morning to prepare all the scheduled cases, starting from the assistant nurse, nurse assistant, then the head nurse, then the anesthesia, then the day will continue like this. So if the patient is not suitable, he will be canceled from the early morning. He wouldn't wait until a senior staff comes and say this patient is not suitable for cath today. This is the video. Unfortunately, I don't know why it doesn't want to load here. This is before Kaizen, our statistics, as you can see. And after Kaizen, we make like another statistic to see if this Kaizen could help in the duration and time of confirmation of diagnosis, late attendance, admission papers, and as you can see, there is like a 50% reduction of the problem. Benefits of Kaizen, it is, as you can see, it is like a convenient way to analyze your problems and composing factors in the workplace, easy to establish an action plan, encourage teamwork and communication between all the working staff. What are the challenges we faced? We need more people committed to the quality work. We need a fixed budget. We have a budget, but it's not fixed. We need higher number of oriented people in the work environment of the Kaizen and what is its value and how can they implement it in their workplace. And thank you.